guys, it's Miss Hardy covering the digestive system. It is Tuesday, the 9th of March. On Friday, you should have begun working on the assignment for this unit. It is the little flow chart that I gave you that we cover the name, symptoms, and then treatment of the digestive disorders. Some of this information you will not see on the PowerPoint, so I gave it to you on Friday. I can give you a little bit more information now. So if you're looking for that PowerPoint, I left it under Friday, Digestion PowerPoint 3. And then, of course, the directions to this assignment and the submission link are posted under today. So we are wrapping up the digestive system by covering the disorders. The digestive system has so many parts and pieces. Remember, it is 30 feet long from the top to the bottom, okay? Or roughly 30 feet. So that's a lot of places, a lot of anatomy, a lot of structures that can go wrong. So as a healthcare provider, if someone comes into your hospital complaining of abdominal pain, there are a lot of different diseases and disorders that it could be. So you would ask very specific questions. Does it hurt worse when you lay down? Does it hurt worse when you eat? How does it feel? Is it sharp? Is it burning? Is it in a specific place in your belly? If I push, does it make it worse? Are you having any other digestive issues such as a lack of appetite, constipation, diarrhea? So whenever, again, someone comes in complaining of digestive dysfunction, you have a lot of work ahead of you because you have so many different things that it could be. So briefly covering what we covered on Friday, we have pyloric stenosis. Pyloric stenosis is pretty common in infants, okay? That's going to be that age group that's most commonly affected. It's something that they're born with. The symptom of this would be projectile vomiting. Remember, we talked about how projectile vomiting is not just a little bit of spit up or vomiting on yourself. Projectile is forceful vomiting because the food, because the way the stomach has narrowed here at the bottom, the food has nowhere else to go. So the body sends it back up through the entrance to the digestive system. The fix for this or the treatment for this would be surgery. Moving on to gastritis. Gastritis is stomach inflammation. A lot of people talk about gastritis and gastroenteritis interchangeably. Gastroenteritis is covered next. That's your generic stomach bug, okay? You've got something, it's a viral kind of thing. For a virus, remember, we don't take antibiotics for viruses. Viruses have to run their course. Now, there are certain things like certain types of viruses like HIV and things like that where we can give you medicine, but most of the time the virus has to run its course. Gastritis is acute or chronic. Acute means it happened one time and it's kind of like a flare-up. Chronic is you live with it all the time. Gastritis is inflammation of the stomach lining. You're going to have abdominal pain. You may have increase in pain when you eat, especially if you eat something that's like super spicy, super flavorful, because the stomach is already irritated, and then you put something in there that could irritate it more, and obviously it's going to make your symptoms worse. On Friday, I introduced the term supportive care to students. Supportive care is what we do a lot of the times with the digestive system. When you guys have a stomach bug, what do? Do you eat spicy food? No, what do? You eat soup, something like that that's really soft on your stomach, that's really bland. So bland foods help, rice, toast. You also probably drink a lot of water, a lot of Gatorade, or even Pedialyte. That's because in the digestive system, it's really important that you stay hydrated because you're not eating much, because you're vomiting, because you're having diarrhea, you're losing all that water and all those electrolytes that you need. So it's really common to do what we call supportive care. Bland diet, rest, increase your fluids, etc. Gonna say this one time, our phones need to be up, okay? All right, moving on to gastroenteritis, like what you see here, it's inflammation of the stomach lining and the intestines as well. It's viral. Complications would be dehydration, okay? If you get dehydrated because you're not drinking, then you have a different type of set of problems, okay? Treatment's gonna be that supportive care. Ulcer, you could have ulcers during multiple places in your stomach lining. It can be from a bacteria called H. pylori. It could be because you smoke, drink excessive alcohol, have stress. Certain drugs and medications also make it more common to develop an ulcer. An ulcer is like a sore or like an open wound in the digestive system. With this, you're going to have pain in your abdomen. And remember, pain in the abdomen is pretty common with all of this. So they are going to have to do more tests and things like that to see what's causing it. What could start as healthcare workers, you can start asking questions. Well, is the pain worse when you wake up in the morning? Does the pain get better when you eat a meal? Remember on Friday, I told you that a meal or an antacid like a Tums or a Pepto-Bismol is kind of like a Band-Aid on an ulcer. So when you eat or when you drink Pepto or take an antacid, it puts a Band-Aid over that wound and kind of calms it down, which makes sense why when you first wake up in the morning, you haven't had a meal, your stomach is empty, the pain is worse. In between your meals, when your body starts to get hungry again, the pain is worse. There's no Band-Aid there, okay? Treatment for this is H2 blockers. Colitis is next. It's inflammation of the colon. Again, stomach pain. You can also have diarrhea and constipation. Diarrhea itself and constipation on its own can actually cause colitis, okay? Because with diarrhea, it's stuff moving too fast through the digestive tract. And with constipation, you don't have enough water in your stool or in your feces, so it's hard, which can cause irritation. We don't actually know the cause of colitis other than we know it can be directly related to diarrhea and constipation. Treatment is going to be running its course and figure out if you are having diarrhea or you are having constipation, treating that. Appendicitis is inflammation of the appendix. If it ruptures, it can spread. The biggest thing to remember with this is appendicitis has rebound pain. If we push on your belly and it gets worse when we let go, then they're going to immediately trigger in that this could be appendicitis. Appendicitis is usually not life-threatening unless it bursts, okay? Treatment for this is an appendectomy. We're going to take it out. Hepatitis A and hepatitis B are both forms of inflammation of the liver. Hepatitis A is kind of like food poisoning. You get it from contaminated food and water. With this, just like food poisoning, you have to let it run its course. So your treatment would be supportive care, rest, increase your fluids, bland diet. Hepatitis B is different. Hepatitis B is a bloodborne pathogen. Hepatitis B comes from exposure to someone's blood who is infected with this. So it could be from using dirty needles. It could be accidental needle sticks in the healthcare setting. We can get vaccinated for this as healthcare workers. Using standard precautions is really important. Standard precaution, the basic way to say that, and let's make sure we're all awake and paying attention. Standard precautions is everybody that you work with, treating them as if they have something you can get, okay? Wearing your gloves, washing your hands. With us right now, it'll be wearing masks as well. Standard precautions is no matter who you work with, they have something contagious, or that's how you treat them. Cirrhosis of the liver is a progressive liver disease. It is chronic, so once you have it, you have it. Now you can slow it down. A lot of the time, cirrhosis of the liver in 75% of the cases is caused by drinking too much alcohol. So you can slow it down by obviously limiting your alcohol consumption, but it's when the normal tissue of the liver, which is really meaty tissue, it's nice, it's thick, is replaced with fibrous connective tissue, which means the liver can't filter the toxins the way that it's supposed to. Cholecystitis is inflammation of the gallbladder, stomach pain here, nausea, vomiting. We're going to take it out. Cholecystitis is gallstones, which are little stones of bile that build up within the gallbladder, and they can block the duct, which would be another reason we would need to take it out. Pancreatitis is inflammation of the pancreas. This also can be associated with chronic alcoholism. Abdominal pain here, fever, nausea, and vomiting. Treatment would be treating the side effects, so treating the pain, treating the nausea, treating the vomiting. Okay, and pain medicine, okay, is a big one here. I've had it twice. It is very painful. Some people are predisposed to getting it just based on their genes, okay? Next, we have diverticulosis. Those are those little sacs that live in your intestinal system. Most of the time, we find them during routine checks for other things like a colonoscopy. It can become an issue when they get inflamed. That's kind of like having infection in there. It causes stomach pain. Treatment for this would be looking at diet. We can also treat it with certain medications. Diarrhea is the last one that we covered on Friday. Diarrhea is when feces is moving too quickly through the the digestive tract. And so you have loose, runny, watery stools because it hasn't even had the time to form a true feces like we're used to seeing. It can be caused by a number of things. It could be nerves related. You could be having anxiety. It could be because of something you ate, Taco Bell, irritated your stomach. It could be infection, etc. So where we're picking up today is new information, okay? The first one is constipation. So we talked last week about how feces is a noun. It's a thing. It's the name of our poop, okay? Defecation is a verb. It's the process of pooping, okay? So when your defecation is delayed, which means you feel the urge to poop and for some reason you can't, we typically refer to that as constipation. For whatever reason, you ate something, you don't have a balanced diet, you're taking a certain medication that slows down the digestive tract, you can develop really hard and dry feces, which means you're not physically able to push it out of your anus, because remember, your anus is a sphincter. The treatment for obviously symptoms of this would be an inability to poop when you need to poop, or feeling pressure in your anus and rectum because that hard, dry stool is kind of building up there. Treatment for this would be diet changes. We need to increase your vegetables, increase your fiber. You also need to increase your fluids, because remember, if your poop gets hard, then you need to increase your fluids so that you run less of a risk of it getting hard and compact and dry. Okay. Some medications for this as well. A laxative basically causes you to have a bowel movement. A suppository, which pulls water from the intestines into your poop to soften it up so that you can pass it. And there are also things you can supplement with, like Colace, which is a stool softener as well, to just try to keep yourself regular. Colon cancer is diagnosed with a colonoscopy. Remember, a colonoscopy is where they put you to sleep. They go up your rear end with a camera, and what they do is they just check out your colon, make sure it looks good. Do you have any polyps, which are like little growths? Do you have any tumor cells or anything like that? That's how you diagnose colon cancer. Colon cancer, a main symptom of this could be abdominal pain and then hemocult, which is basically blood in your stool. If you're having routine amounts of blood in your stool, they're definitely most likely going to do a colonoscopy anyway to find out what's going on. Now, thinking back to constipation, if you push out a really big poop, you can have little tears and injury to your anus, which could cause blood. That doesn't necessarily mean you have colon cancer. So they'll rule out other things first. Okay. Surgery is going to treat this. They'll remove that part that has cancer in it. A colostomy is basically where, on the next slide, you'll see what we call a stoma. A stoma is actually where part of the intestine pushes through the colon, will actually push through the skin. So this is on someone's belly, and attached to this part of the colon will be a bag. And that bag will serve to collect feces instead of you actually pooping, because odds are they've removed the part of your colon that had cancer in it, okay? There are a number of different places that you can have colostomy bags, okay? So if you had cancer in your descending colon, then they can put it in your ascending colon or your transverse colon, and vice versa. So depending on where that cancer is and what they have to take out is where they're going to put that colostomy bag to collect your poop. As a healthcare provider, most of your patients, you'll find, know how to take care of themselves. When they have a colostomy bag, I will warn you, most patients will ask you to step out when they're changing it, because poop is not going to smell delightful no matter where you are. But in my experience, a colostomy bag does have a much significant, stronger smell to it. It also does get gas in it, because remember, gas can build up anywhere in your digestive tract, and sometimes they'll have to burp the bag, which means let gas out of it, and it is a very, very strong smell. So if you see that as a healthcare professional, just make sure that, you know, if they ask you to step out, or if you need to excuse yourself if you're sensitive to smells, that's okay. Most of the time they've had this either for years, or they're more comfortable doing it in private, and they know that it has a smell as well. Moving forward to caries. Caries in the next few that we're going to talk about are a little bit different, because we're talking about the entrance to the digestive system. So we're not actually talking about abdominal pain here. Caries is basically excessive tooth decay and cavities. Some people have really weak teeth anyway, just because their parents had weak teeth, or they just, you know, did not hit the genetic lottery when it came to having strong teeth that could withstand a lot of, you know, different types of food, acidic things that can break down teeth over the course of time. Caries can also be caused by bacteria that live in your mouth. The treatment for this is going to be fillings, which means we go in and fill the cavity. Crowns, where we actually put a false tooth on top of the tooth that's bad, so that you can still use that for that mechanical breakdown that we talked about in the function. And then extractions, if it gets to the point like what you see here with this tooth, that tooth is likely causing that person so much pain and discomfort during chewing that they're just going to take it out. Next is gingivitis. Gingivitis is gum, itis is inflammation. So what you see here is pretty significant gingivitis. The gums are red and swollen and inflamed. It looks like this person may also even have some infection in here. Most of the time, gingivitis is caused by poor oral hygiene, okay? So even if you brush your teeth every day and even if you floss occasionally, you can still have plaque and tartar that build up in between your teeth, and in between your teeth leads to it causing issues with your gums. So just make sure you visit a dentist regularly. We're going to encourage our patients to do the same thing. Treatment for this is going to be to improve your oral hygiene. If you leave gingivitis untreated, it could lead to periodontal disease, which means you could eventually lose your teeth because you're not taking care of them. So you would encourage your patients to make sure to maintain good health, that you send them to the dentist, and that you yourselves do the same thing. Brushing is not enough, okay? Next is jaundice. We talked about this a couple of times in the past. Jaundice is an issue with your liver. So we have two different scenarios here. We can have someone who is an adult who develops an issue with their liver, whether it be hepatitis, HIV, cirrhosis, alcohol use, whatever. And then what you see here, the second term, buildup of bilirubin. Bilirubin is basically in infants, and sometimes when infants are born, they're not able to like detoxify out that particular thing, so they will have that yellow appearance to them. Many babies are born with like kind of yellow skin, but they will put you under Billy lights, which helps the body process through that as an infant. So kind of different causes here. As an adult, it would be obviously due to some sort of liver issue or dysfunction, but in children, it's just something that happens sometimes when they're born. A little tag here: as a healthcare provider and someone who has a lighter skin tone, it is easy to see the yellowing of the skin. And someone with a darker skin tone, it may be a little bit more difficult. I typically check fingers and then the whites of their eyes, like you see in this picture here. That will give you a quick idea that this person may have a liver dysfunction going on. And as a physical therapist, as a physical therapist assistant, I'm not diagnosing these things. They're just things that I may see in the chart, like patient is suffering from a chronic hepatitis infection or whatever. But you guys may be doctors, you may be nurses, you may see things that a doctor missed. So if you're spending time with your patient and they didn't come in with yellow skin or eyes and you're starting to notice the yellowing, that would be your cue as a healthcare provider to say, hold up, something's changing, okay? Moving forward, when we talked about gallbladder disease earlier, this is one of the methods that we use to do any sort of abdominal surgery. We call it laparoscopic. And instead of them cutting you open completely to go in and remove your gallbladder, remove your appendix, whatever, we do it with small instruments that we stick through teeny tiny incisions. And it's almost like they've stuck them in like this and they're working with it versus cutting you open. The instruments go in through these small incisions that you see here. We go in, we do what we have to do with removing what we need to, like the gallbladder, the appendix, whatever. It decreases your pain because we haven't cut you completely open. I have been cut open almost from hip to hip to have my child. That means we're cutting through muscle, we're cutting through connective tissue, we're cutting through your skin. You need a long healing time for that. It's usually at least 6 weeks, okay, to try to let things heal. So with laparoscopic surgery, we can still serve you by taking out the gallbladder, taking out the appendix, or doing whatever we need to do, but the healing time is a lot less, which is great for those of us who, need to get back to work, have full-time lives, family, whatever. These are quicker surgeries that are just so much of a healing time. And remember, if you have an incision that's this long, you have this much more risk of having infection versus incisions like this that are usually an inch or less. Okay. Now we're going to talk about a couple of different disorders. These are different. These are not disorders necessarily associated with the digestive system per se. They are mental health disorders. We are going to talk about the difference in anorexia nervosa, and bulimia nervosa. Anorexia is just a term that we use to describe someone who has a lack of appetite or they lose their appetite. Think about it. Has anybody ever been through a really bad breakup and you just didn't feel like eating? Then that could be described as anorexia. If when my stress and my anxiety are high, okay, my dog is sick or my kid is sick or my husband is sick, I don't feel like eating. That's a stress reaction to me. So that there is a difference. So anorexia is just a lack of appetite. It becomes a disease or disorder when you have anorexia nervosa. This is a mental health disorder, okay? This is an emotional disorder where the person is obsessed with not eating to lose weight and over exercising. Now think about it. Our food is our fuel, right? Just like you put gas in a car, your food is your fuel. If you're not putting fuel in your system, you're not eating, then your system is eventually going to give out. That is when anorexia nervosa becomes a life-threatening situation, okay? If you're not putting fuel in your body and you're still exercising and you're still going to work and you're running on E, eventually your body will shut down. Again, that's how it becomes life or death. To treat anorexia nervosa, regular anorexia can be caused by stress, another disorder, certain medications. We can give you medicine to increase your appetite. With anorexia nervosa, because it is a mental health issue, it must be treated very carefully. You have to be treated under someone who is licensed to do so, like a psychologist or a psychiatrist, because that's not your body reacting to not being hungry. That is you having a mental state of mind leading you to not eat and over-exercise, okay? The difference in that is bulimia. So bulimia nervosa is also a mental health disorder. It has to be treated under a licensed professional. Bulimia, usually those patients have a misinterpretation of their body image. So they may be a size 2, but when they look in the mirror, for whatever reason, their mental health tells them that they are overweight, obese, they don't like the way they look, they feel sloppy, they don't feel healthy. But bulimia is basically, it's like a cycle. Okay, and we're going to talk about that cycle here in this picture. So what happens with bulimia is the person will have cravings, they'll start to feel stressed out, they will overeat, which we call binge eating, which means they may eat 14 hamburgers at one sitting, 2 subs, 2 large pizzas. Then they will do what we call purge, which means they will take laxatives, they will cause themselves to vomit that food. And remember, if our food doesn't stay in our system long enough for us to pull nutrients from it, then they're just hurting themselves by constantly forcing themselves to throw up, okay? Because all that stomach acid that's supposed to stay in our stomach goes into our throat. It goes into, with the laxative, it can cause irritation within the rest of our digestive system. So once they purge, they will feel shame, they will feel disgust, they will once again reflect back to, I hate myself, I hate this appearance that I have, etc. And then they will go into strict dieting. So it's a cycle. It happens. They may purge once a week, they may purge once a month, but either way, they are in an unhealthy cycle of trying to lose weight or trying to control their body image. With that being said, I do like to make sure that you guys know, as healthcare providers, we typically think people who have eating disorders may be exceptionally skinny. They may be people who don't even look like they have eating disorders, but eating disorders do not discriminate. They will affect people of all shapes, all sizes, all family backgrounds. You can have someone who is morbidly obese that has an eating disorder. You can have someone who looks healthy and doesn't look excessively skinny, like what we see here in these other pictures, like what you see with this gentleman right here. Sometimes they do look like that. Sometimes they look like this gentleman who looks really healthy. So make sure in your mind as healthcare workers, you don't judge appearances, okay? You make sure you watch your patients, you ask them lots of questions, etc. What questions do you have, and how can I help you understand any of these disorders a little bit more? If you're missing a treatment or anything like that, what can I fill in the gaps for you? Does anybody at home have any questions? Remember, your assignment is due tonight with the disorders. Tomorrow, we are going to kind of review. I'll have a review for those of you who are at home, and then I'll have a review for those of you who are in class. Our test is going to be on Thursday. It's 31 questions, but it's worth 50 points, okay? I encourage you all to continue working hard throughout this semester because you do have a final exam for this class. If we have time to review, we will. The treatment for jaundice is going to be to treat the underlying issue. So is the person jaundiced because they have to have a hepatitis infection? We'll treat hepatitis. Is the person jaundiced because they're an alcoholic? Then we need to treat the alcoholism, which will in turn treat the jaundice, okay? And make sure you guys are staying on top of this. The work that I give you is supposed to help you in your studies. So if nobody has any questions, you can continue working on this and or makeup work. If you are finished, you can work on highlighting information on the note guides that I've given you to help you pull out information to study. I am going to stop recording at this time.